the movement of some rotations to pass fail, for many medical schools where getting honors on those rotations is so critical to class rank or GPA, and then being able to put together a very competitive application for applying to certain more competitive specialties, that also was this huge unknown variable. At least here, how was AOA status and how were things like that managed?
To be determined still. And
post-match still to be determined.
Still, well, as the current group of students come forward, what's interesting is there is a very critical look right now at making the whole school go pass-fail, kind of on an ongoing basis.
Which has been done at other schools.
Which has been done, and that's exactly the impetus to take a close look at the University of Cincinnati. You're exactly right. And so when it first came up for discussion, maybe 4 years or so ago, everybody thought, well, I don't think that's really going to happen here. Now, I'm not sure, but it is far more plausible that it would happen here. And so the discussions that are the offshoot of that are then what does AOA look like? Does class rank fall away? How does that impact students who are applying for more competitive specialties? So that on the heels of step one, going to pass-fail, a lot of the metrics that have kept residency program directors kind of anchored in their decision-making are falling away. So it will be interesting to see how that plays out.
So potentially more medical schools go pass-fail. Step one's gone pass-fail. Step two will still have a numeric score, but program directors are losing a lot of these traditional metrics they had for being able to figure out who would maybe be a good fit for the program or specialty. How do you see that changing things?
Well, it's interesting that the two main drivers for this pass-fail, one of them is wellness, the whole concept of burden, stress, and wellness for medical students. The other driver for a pass-fail system is taking a more holistic approach to developing students and encouraging program directors to take a more holistic view of students, which I think is a wonderful thing. But truth in advertising, what I must say is ophthalmology is the only third-year elective that has the option to get honors. All of the other non-core clerkships during the third year are pass-fail, other than ophthalmology. And that didn't happen by accident. I made a specific petition as the medical student educator, the clinical, the clerkship coordinator for ophthalmology, to keep it as honors because I am aware that is advantageous to people who apply in ophthalmology to demonstrate that they are able to perform at an honors level in ophthalmology. So I am not sure. As I sit around and talk to program directors, I think in theory, when you talk to them at first, they say, well, that's great. We'll evaluate people holistically. And then all of a sudden, the conversation switches to, but we still have step two, and that has a score. So I think we're going to move away from metrics pretty slowly.